Welcome to the Global Good Podcast, where each week we'll travel around the globe meeting the most incredible people doing the work that's truly making the world a better place. From the peaks of the Himalayas to leagues under the sea, join us as we embark on adventure for good. Having good vision unlocks human potential. Without the ability to see clearly, students can't learn effectively, adults can't work productively, and almost everything in life becomes a challenge. Yet globally, 1 in 7 people who need vision care don't have access to it. That amounts to over 1 billion people, with vision loss costing over 400 billion in lost productivity annually. And in Rwanda, a country of 12 million, there are over 1 million people with vision loss. But the people of Rwanda have overcome so much and become an example for the world in more ways than one. You might say they're visionary. Today, we're talking to Vincent Tuzindi, a Rwandan who grew up as a refugee due to the 1994 genocide of the Tutsi minority by the Hutu majority. He's the country manager for OneSight, an international NGO that has served more than 10 million people across 53 countries, and hosts almost 2,000 vision clinics. And in Rwanda, they have 45 sustainable vision centers that provide affordable care, staffed by locals. He's calling in from one of those clinics today. By the end of the conversation, it will be clear that lack of access to vision should no longer be a barrier to human achievement. Or as they say at OneSight, they have work to do until the world can see. Hello, Vincent. How are you?
I'm fine. I'm doing great, Nicole. How are you?
Good. I love that background.
You. OneSight.
OneSight, for those who are listening and can't see the visual, his entire background says OneSight. It's so happy and bright. I love it. Are you in clinic today?
No, today I'm not in the clinic. I'm at the office.
Mm-hmm. Nice.
Yes.
So the conversation today, we're going to talk about the work that you do, which is just, beyond impressive, and the work of OneSight around the world. But I think what makes this conversation with you so important is that you're home in Rwanda. And, when we think about Rwanda, the first visual that comes to my mind actually is gorillas. and I know for a lot of people that's true, but I think, it's safe to say for the vast majority of people, when they hear Rwanda, they think genocide. And I know it's exceptionally difficult to talk about, and you were very young, but I've also heard you describe your country as a small country with big ideas. And I love that mentality. And I want people to learn about the country and all that you've been able to accomplish in, just over 20 years. It is truly stunning and a model, I think, for the entire world. So I would actually like to go back to sort of that beginning, and we'll say the beginning in the 90s, where everything was sort of reshaped. And, please take us back to the 90s and show us Rwanda through your eyes. I guess pun intended, since we're talking about vision today. But, let us go with you to the 90s when you were a boy and talk to us about what life was like in Rwanda.
Thank you. Thank you so much. Again, when you say gorillas, you're right. We are identified as well by that in the country because we've managed to conserve the world is, I would say, very extinct species that we've conserved now, and the world is coming now to see how we've done that and how it's kept and growing and, back to nature as well. Think about genocide. Yes, we call it the genocide against the Tutsi. That's the right terminology in Rwanda. And of course, that has also become part of our history, but a history that has been able to shape us into, I would say, a people a community that has now built togetherness than any other community I've seen in the world. I would say that it's a bad history, but a history that we have built on and think beyond and go forward to see that we never go back and plunge into that mayhem that happened in Rwanda. To take you through the 90s, I would say I myself, as Vincent Tuzinde, I was born and grew up in Uganda as a refugee. My parents were refugees that fled from Rwanda in 1957. They came to Uganda. I was born later, years later, when they are settled in a refugee camp. But within that, I never forgot my identity. My identity belongs to Rwanda. And I was proud of that since then. And then there comes the 90s when it was deemed necessary that things have to change in this country called Rwanda, because we were denied entry as refugees to come back. We were told that the country was full, we can't fit in the country. That's just the history. But of course, we had to come and try to settle in, which didn't go very well. Of course, we had to find a hard way to come in, a way that would help other people have better lives and all that. So we came in. Then there was a genocide in 1994. That would say a very bad story, but it was a planned activity by the then government. But I would say that we have heroes that managed to fight through and stop that genocide. We have living heroes, we have those that have passed on, but those ones have now shaped that country that had now plunged into chaos, plunged into what a society that you never think of in the world, a society without, I would say, togetherness, a society of fear, a society of doubtness, a society of no commitment anywhere, because everyone had lost hope, had lost sense of life, had lost sense of anything that could help people go beyond that. So in the 90s, come to 94, stop the genocide. Now a community had to come out and sit together, which wasn't easy. And everyone wanted to help, to see that this community that has been dismantled should step back, get the right foot, and resume and develop. Yes, we received that help from different organizations, countries came in to help, but still there were reservations because help is given, but won't stay forever. Right. Meaning that we had to sit to think of other ways that we gonna stay as a country, survive and support ourselves. Not forgetting that we have people and souls that have been affected. People have lost families, people have lost everything, like to even infrastructure, no homes, no schools, have been demolished and everything. So we come from that background and say, yes, you can help, but now we need to come up. Those that have remained, we need to come up. We have people that have wronged each other. We can't fill the prisons forever. So we need to reconcile and sit together. We need to find a way that now can build us together. Forgive, but don't forget.
I like that. Forgive, but don't forget. And so,
yes, it might happen again.
Right. And I mean, in this case, it's one generation away. Yes. I mean, this is so new. And I've heard, and I think this is just, beyond comprehension for a lot of people. But when it came time for reconciliation, the country did away with the death penalty. They said we've had enough death, no more death. And you created community-based courts. And so in place of, punitive justice, the country as a whole focused on restorative justice. And people were literally held accountable to their communities. Their communities, their peers were their judges and their juries.
Yes.
I mean, after something so difficult, it's hard to even imagine that sort of timeout that everyone took and said, we have to heal together. I mean, how is that even possible?
Yeah. So I would say it's, I would say, a worst or a bitter medicine we have to take as a community to live with those who have wronged us, to forgive them, and look forward. In this, I would say, community courts or gachacha, how we call them, you could find even the one who committed the genocide and the one judging him most. Sometimes this is your uncle, your auntie, they know you, the neighbors knew what you did, communities were there, and you talk about it, you serve your sentence with a reconciled heart, a reconciled mind, a reconciled feeling, you know, that when I go back to my community, I'll be welcomed and help in the construction. So this has healed a lot of souls, and families have again come back together to live together. And that's why today you see that. That's one of the pillars that has helped us to be where we are today, because of that kind of togetherness we took up and developed this country and listened to each other. Okay, so that has helped us a lot. Yeah.
Yeah, it's so
So
impressive.
yeah.
Well, you mentioned, people coming in and wanting to help, but you know, we, and by we, I mean the entire world, we failed you. We failed Rwanda when everything was happening. And I see you nodding your head like, yes, yes, you did.
That's true.
And, we can admit that now. And, our media failed you, our humanitarian aid failed you. So, given what you do now, I mean, you've got more than 15 or about 15 years working in international NGOs. So you have seen and treated the most vulnerable people. So as we start to think about where things are today and the progress that's been made, tell us a little bit about what things were like before. So, for example, if someone wanted a vision test,
Yes.
how would they have accessed that or gotten to that? Was it even possible?
Yes. So I will start relating this to the whole, I would say, health sector in Rwanda. By then, I would say since 1994, even before that. So when the country kind of picked up its feet and rose again to see that now we can be a better and greater community, there was a lot going on. Infrastructure had to be looked at. Schools had been destroyed, so education was very low. Families had to look for food, and agriculture was very low. Uh, Health being part of that, a bigger part of the human being, also was really doing so bad. So the government had to make priorities, mostly to look at, I would say, what does the community need currently? And remember, we have these killer diseases in Africa that are affecting people on a daily basis: malaria, HIV, TB, and so on and so forth. So the government had to make choices, immediate choices, about how do you go about not having infrastructure, not enough hospitals, but even if those we have, what can we now take into account as an emergency and build this structure? So through that, of course, the country got more support, but that didn't bring in mostly, I would say, high healthcare and priority, but they had to look at diseases that are killing people, I would say, in the front line. As that grew in, of course, the government also looked at other, I would say, activities or health impacts that can be now looked at and be added in each and every year as the country goes to plan. So one was to see that now at least you have facilities where people can access healthcare. So meaning health infrastructure is put in place, starting from hospitals, provincial hospitals, district hospitals, referral hospitals, and now to each community to see that at least they can get a health center where they can go to seek their first day or first treatment of any kind they feel they want. Now, looking at this structure, in relation now to eye health, I would say eye health sector, That also came in now to fit into this structure. Why would I say that? Is that since the structure starts from the health center, which is the lowest level of the community, so those people also had to come in and get the services they get from the health center. So it was, I would say, great and easy for any support that would come in the country to tap into those built structures that are within and can access the community easily. So that's how now also the eye health sector came in from different NGOs. Government had put in some infrastructure, supporting equipment and all that. Training started going on for ophthalmologists and would say clinical eye health clinic officers to see that now even that part starts growing and people can be now treated with any eye health issue they have. So in this, that's when also OneSight comes in to see that now we can build or give a hand to what the government has already put up. And in that, we want this to see that it stays within the government system because they're already now built after 14, 13 years, and that will stay forever because the government is there to stay. Yes.
So how long before OneSight, how long would it have taken someone to get a vision test or a pair of glasses?
That's a good question. That is something that all along before even 1990 up until 3 years ago, 4 years ago.
Wow. Only 3 or 4 years ago?
Yes. If a person had to get an eye exam or glasses, he would go to the health center where there is a primary eye health care, the basic they give to anyone who comes in. But for any referral, get referred to the district hospital for any other, I would say, upgraded eye care. But the facilities that are there weren't really enough. And also the human resource at that side in healthcare wasn't really enough. So this person, if they need glasses, has to travel from a village to come to Kigali to buy glasses. Kigali is the capital city. And that would take him or her a day to come to buy the glasses, and another day he or she took to go and access the health center. And the movement, transport was also so expensive for this person to go and come back. And you find this will take almost 3 to 4 days for someone to now access his or her pair of glasses from the village to the city center. So that was only the travel.
Only the travel. Just to travel to get glasses was 3 to 4 days.
Yes.
Wow.
So that was really difficult. But now what I would say that since we've now put the infrastructure into the government structures, today it is only taking a day's travel from your home to the health center or to the hospital where you can now access those services. You can even get glasses at the facility.
And when you say 1 day now, I mean, you literally mean the entire country. Like all 12 million people are within a day of vision care. I mean, that's a huge improvement. I mean, that changes lives completely. And so something you've said now a couple of times, and I actually wrote it down, is you talk about infrastructure and you talk about rebuilding. You also reference government and when the government set this up and when the government helped facilitate. And I think for so many other people around the world, when they think of good healthcare and access to healthcare, they don't think of government as being one of those drivers. And so, maybe explain just a little bit about how the model works with government helping you scale.
So much. Thank you so much. Now, for this model to work, it would never work better or anywhere good if you don't talk with the government directly. Because the government has invested a lot in infrastructure. And it would be, I would say, not really a good choice for you to come in a hospital and set up another hospital or eye care hospital within or near that very big structure that government has put up. So that wouldn't be sustainable because that's your own as an NGO, you do the construction. Ownership will not be the best because at any time, OneSight has to go and create impact somewhere else. So when you work with the government directly, you are easily facilitated. You are given the infrastructure, 3 to 4 rooms in a hospital that you can now put the equipment that you've brought and discussed with the government, and the government staff will use that now to come and treat all the communities that come to them. So meaning that if you go within the government structure that has been built already in the country, because each hospital, each health center has an eye care department. So because it is already in the government structure, so it is a well-thought option to come and build into what the government has already put together and make it stronger, and it will stay with the government, with the communities, today, tomorrow, and forever. And that means it will be sustainable.
Right. And that's a real meaning of sustainability. Like for some, hearing you say that, it's, and I say this right now, not being able to, like, I'm sitting in the US, I'm actually in Washington, DC, and I'm hearing you talk about every clinic, you can get vision care, and these are fully sustainable. And we're going to talk a little bit more about that because I'm really curious about how the pandemic has impacted what you're doing. And yet I think I don't even have vision care with my main insurance. Like, I have to get a separate secondary set of insurance to go with my original insurance that covers health. And when we say health insurance, that doesn't include vision. And so I'm as you talk and I'm comparing our systems, it makes total sense. And yet what you're doing, so many other places are not doing and haven't even thought about. And it's actually kind of mind blowing. So earlier I want to go back to something you said about, you mentioned all these international organizations wanted, and rightfully so throughout Africa, they want to focus on TB, malaria, HIV, these pervasive things that the country's been dealing with, that the world's been dealing with. And yet, when you think about holistic healthcare, simple things like driving. I mean, if you can't see, you can't, well, I suppose you actually can drive. You just shouldn't be. But in a country of 12 million people, if it takes days and days to get care, to be able to see, even to get a vision test, that means you literally have millions of people driving who can't see or should not be on the road. I mean, those simple day-to-day activities of working in your field. I mean, children trying to learn, read, look at a board. And so how do you get the country or people to focus on those day-to-day activities, those day-to-day needs that are often completely overlooked for the much bigger problems? And I guess when I say bigger problems, I mean in terms of how we view them, not necessarily in terms of their actual importance.
So I'll go back to this model first and foremost. It is a sustainable model that we've built within the government structure and the government support. And I would say that this is a model that you've found that in every government hospital, you're able to find the best equipment, eye care equipment that an ophthalmologist, optometrist can use to test an eye health issue. It's a model that you find a patient walks in that department, get tested, and if there's need for glasses, she or he will buy them in the same hospital department. This is happening now. It's something that has never happened in other, I would say, hospitals, in government hospital. I would maybe be corrected with my datas, but I think government hospitals never had such, I would say, service that is full equipped with state-of-the-art equipment, with trained personnel to handle each and every eye healthcare within the same service, and not to have patients move to private, I would say, hospitals or go and look for other services outside. So that's the model built with the government of Rwanda currently, and it's also replicating in other countries where OneSight is now working. So coming back now to access and how people, such populations, have been able to now look at their daily, I would say, focus on daily activities, and also know that services available. Through this program, we also launch a very big and massive awareness campaign, because it wouldn't be good to invest a lot of, I would say, knowledge, equipment, and efforts, and the community stays unaware of what is happening in the country, where they can access such services, what's provided in those services, and how, or they need to know if they have any eye health issue and where they can seek advice and service from. So with that massive awareness campaign, we talk about that also, and the communities will know that now this is available at my nearest hospital. I can go there and have my eyes checked. And when you look back again, you can't stop there again. You look at other populations, what we could say like frontline populations that are holding other people's lives on a daily basis. Talk about drivers, talk about teachers. So drivers need at least to see that their eyes are tested before they get their driving license. And now we are sure of the security of those that are driving, and also minimize accidents that have been happening on roads, because people can't drive at night. People can't see very well. And that also puts a lesser cost on the government in emergency services where they're handling accidents. So we need to look at these frontline populations that also need to access these services at each and every time, so they can also guard other communities through preventing such accidents and all that. When we look at teachers, if a teacher doesn't access glasses or his eye health is not doing well, then students will not get quality education. If a student can't be able to read and write because she can't look at the blackboard, she can look at the board to write, she can take her notes, she can't revise, then that means that we are not going to get leaders tomorrow, economists, other teachers, and all that. So we also look at beyond that. How can now school children also access these classes, access these services, access and have their eyes tested, and they're able to do that? How can you look at that old woman, that old man, or that lady in the community who is a farmer? When she goes to his or her field, she can't easily pick his or her rice in the field. She can't harvest her produce. She also needs to access that service and get tested, if need be, get the glasses. How can you look at a woman in the market who is selling her produce? She just can't well her money and all that. So this comes in as a great answer and opportunity for everyone to come in and access that service. And has been a good answer in a very different ways to different peoples, the communities.
Yes. Yeah, I like what you said, because, and you just said community, and every example you just gave at the core, I mean, all of those are super local. It's all about, the local impact, the local community, individual teachers and students. And I also like how you view, this is about the future. If children can't see, they can't read and learn, and they don't have the confidence that they otherwise would, and thus they don't grow up to be the leaders that they could be. People are on the road endangering family. I mean, each of those is a big problem, and yet they're very specific individuals and examples that each community has to be thinking about and working to solve these problems. I was also really struck as you were giving those hyperlocal examples that, at the same time, OneSight serves millions and millions of people. I mean, in fact, sustainable vision clinics exist in 10 countries, and you and Rwanda are the model, right, for all of these countries. Every time I've spoken to someone at OneSight, they always say, well, in Rwanda, we're doing this and we're doing that. And that's led to more than 42 million people who have gotten vision care through the OneSight system. And beyond that, more than 10 million, the last time I checked, had gotten glasses, and OneSight had worked in 53 countries. Yes. I mean, that's mind-blowing. But so with Rwanda being the model of how to be sustainable, let's talk about the impact of the pandemic. I mean, you mentioned earlier that things only got set up a few years ago. I really thought the program had existed longer than that in your country. And so in a matter of less than 5 years, you have, had people trained, you've had to work together, you've had to partner with the government, you've had to find lots of other local advocates and partners and communications teams. And I would think right as you get going, then there's a pandemic, and all of a sudden everyone has to leave. They exit the country, and it's like, each country becomes its own tiny island almost. So how have you responded? How has Rwanda and OneSight jointly responded to the last year?
Thank you. If you would look at when the pandemic started, everyone was shaken. The world wasn't ready. People weren't ready, including Rwanda wasn't ready for that. But I would say we picked up so quickly as a country. Then, as you can read through, you can see that Rwanda is ranked among the best countries, I would say, the first country to fight the pandemic in different ways, putting up quicker prevention measurements, quicker emergency services to see that the communities are not really highly affected. So that also comes within people working in the country, be it foreign communities in the country, be it foreign organizations that picked up quickly to see that this does not hit so much to the organization, but also even if it hits, there are plans, contingency plans so that we raise up quickly. On the side of OneSight, same, like many countries and other organizations, OneSight, this came, I would say, as an opportunity in disguise to sit and think, how can we continue serving our most needy in the communities? Yet countries are into a lockdown, no movements allowed, people are now into their homes, but they need to access their basic health services to the hospitals. So what can we do as an organization where we're working from? We need to sit and look what can we do better in this pandemic. We'll tell you that we continued what we are doing. We continued opening vision centers, but we designed a way that fits or suits within what was happening in the world.
So wait, you've continued opening clinics?
Yes, we never stopped at any time. We decided and redesigned our model or approach towards the community, how we can continue making those installing vision center equipment in the hospitals. How do we continue to support the local staff, hospital staff, to get trained and continue serving their own populations? And we now opted what the world has also took up, the virtual way of supporting, the virtual way of talking to people, the virtual way of supporting people to go on with their daily work. And also, we empowered the local communities, the local nurses, the local doctors, the local opticians to now train their fellow new staff in hospitals to now also start their vision centers within the pandemic. And within that, we've opened 11 vision centers, the last ones we've opened in the country. And we've done it within the period of this pandemic. So this never stopped us, but gave us more strength and courage to work through the pandemic, but because we had someone to be served in the community, someone who didn't have access to vision care. And that kept us moving. We said, we can't stop, but we can't continue.
As you were talking, I kept laughing and shaking my head. I mean, that given all the things we have seen fall apart in the past year, the programs that failed or stalled, you've been growing and expanding, improving. And so, we started this conversation talking about how your country is a model for the rest of the world on how to heal, how to forgive, how to move forward, how to rebuild. I mean, rebuild everything from infrastructure to families. And now you're describing the models in which you view like vision care as part of, day-to-day life and people's abilities. And you're describing a model that is not only sustainable, it's scaling. I mean, I'm actually just blown away because, as far as I can tell, the whole world should be looking to Rwanda and the resilience, the perseverance, and your just ability to do so much when given so little to work with. It speaks volumes about your people. And it really goes back to that quote at the beginning I said that I've heard you say, which is, we're a small country with big ideas. I totally get why you say that now. So I guess I want to know what comes next. I hesitate to even ask that question because you've already surpassed every expectation, every vision that people could have. But say we move post-pandemic in the next few months, the next year, even if we don't, what are your goals for your country? What are your goals for running OneSight in your country? What do you think's possible?
Very good question. Now we've had already all hospitals have vision centers. Everyone can access the nearest hospital and get the same service in Kigali, capital city, the same service in the village, in the west, the south, and north, and the east. Same service you can get, and you don't need to travel to Kigali. That's one. But now, what happens next? Where do we see us in the next 5-10 years? When you build a model like this one, you need this model to stay forever. As a project, we've worked with the government to devise ways and means of how now this can be embedded, can keep growing, can keep forever within the government structures and be taken up and be absorbed and continue working within the same structure. So we are now looking at a transition process, very smooth process. How now do we find what OneSight is doing? How can now this be done by the government? It's a process we are now into that we've introduced. And from now to 5 years, we shall now see how all this has been taken up 100%, and everyone will be accessing the same service they have seen today 5, 10, 3, 30, 50 years to come.
What kind of
So that's
partners do you need? And I'm sorry to interrupt you there. What kind of partners do you need to make that possible?
this, I would say, is very simple yet critical. The government is the best and the most partner you ever wish to work with because the government is there to stay. Rwanda committees are there to stay. So if you don't put this within the built structures of the government, you might not get the best partner. But the government is the best partner that can easily go on with this. Yes.
Interesting. Again, coming from a totally different mindset about the role of government. But it also it strikes me, as just the opposite of how we often think about things in other countries. And yet, when you say like they're not going anywhere, I mean, that's the truth, right? At the end of the day, there's going to be government, so you might as well use them to do the best that you can with what you've got. That's hilarious. And I've also heard you talk a little bit in the past about police. You had mentioned some kind of partnership with the police. Can you talk a little bit about that?
Yes. Thank you. You can never, I would say, impact a life of a driver, a life of a passenger, to minimize accidents, to minimize any road accidents and all that, without working with the police. The police awards the driving license. The police controls accidents. The police looks at all that. So it is very vital and important to work with the police in a program that will implicate the drivers, because this program looks at working with the police in a process where they are awarding or they're giving out driver tests and giving up driver license. In this process, we embed in a system where drivers can be tested to see if their eyesight is well and can be recommended for driving. If there's need be for the driver to first have his eyes checked, then it is simple and easy. The country has now been set up to welcome everyone in each and every hospital, nearby hospital. So this driver will be sent to the nearest vision center to go have now his eyes properly checked. If they need glasses, they'll be awarded the glasses. And this will also go in the police books and also be part and parcel with driver license. So this traffic police officer will easily see if you're driving and you had to put on your glasses, you're not putting them on, then you might cause an accident. Then he will remind you. If I say remind, you know what the police does. It's a polite reminder with a fine or not, but at least this will prevent accidents and people will not be affected by this. So
He said when the police
is,
remind you, you know what that
yes,
means.
it is important to work with the police in this program because they will enforce this on daily basis to see that nothing happens. And they are now a very great partner on this program.
Sure,
Yes.
that's great. So, why do you think vision care, testing, glasses, why do you think it is that no matter where you are in the world, is not necessarily something that we think about in terms of our healthcare? What is it about vision that is vitally important? I mean, whether you're a child all the way up until, the elderly, being able to see determines so much about, your work, about your ability to drive, about, your ability to see the board, do your homework. Why is it that it's something that always seems relegated to sort of like a secondary problem?
Uh, On this issue, it is a very big issue in the world, but of course scales down to every continent. When it comes to Africa, it's something else, being that even all governments in the world haven't planned for this. I would say, do not put a lot of their plans in the health sector until I would say in the last, I would say maybe 10 years or the past 10 or 8 years, when big organizations like IAPB have come up to advocate, NGOs have been created to see that now eye health comes up. But this seeing is a necessity, actually a basic necessity, because we don't see well, then your life kind of affected. So you find that government didn't put in this. Some governments is because I would say never give priority because of other, like I said before in starting, other very important and life-threatening health issues. For Africa, we talked about malaria, HIV/AIDS, and all that. And priority was given to those that would take up people's lives so easily and quickly to see that they can protect the communities. But as time went on, a few none came on to be now added. Now we look at NCDs, non-communicable diseases that are now have come in. People are now dying of cancer. People are now dying of heart diseases, high blood pressure. And all that you can see that now governments have come up to see that how they can support that sector. So that goes along also with eye health that has been lagging behind because they have been fighting other killer diseases that have been affecting the communities. And eye health has now also been picked up recently when I would say others kind of have been lessened with effects on the communities and kind of been now going on slowly. So that's how we find a lot of players now in the eye health also trying to see that. Now people have come up to promote eye healthcare in the world.
Which makes your point earlier so important, and that is, to embed vision care in all other care, to have it in every hospital, every clinic, because it's vital, and yet people go to the hospital or the clinic most frequently for something else. And so it's so important to just have it as a coupled sort of visit. It's always an add-on. It's always an offering. That's fantastic. I mean, that model makes total sense.
Yes.
And so for you, what comes next? You're in clinic today, but what does the near future look like for you and your clinics and OneSight and where you're working?
I would say for the near future is to see that now come 5 years, I would say at the country level, to see that each and every vision centers we have already set up with the government become sustainable, meaning that every community can access the hospital and find the same service, the same equipment, well maintained, the same quality of service offered, and I would say serving the communities very well and sustainable. So the communities hospitals are able to now buy their own equipment when they need to replace, pay salaries to their government workers through the Vision Center funds that they have generated. Because communities come in and they pay for that. We have a health insurance that we need to see that also it covers the eye health diagnosis. Even if it's eye surgery, they cover that. But now we need to see that also the government starts covering also the purchase of the glasses on the community health insurance that everyone in Rwanda has and is paid for by the government. So in the near future, we are focusing on that currently.
Yeah.
But then we need to see that this model scales up to other countries in Africa where it is needed, where communities need such a service, and we are looking at that as well.
I
Yes.
mean, beyond Africa. I would love to see your model scale all over the world. I'm truly inspired. And as you were just talking, I think what stood out to me as so important is you're not only talking about ensuring that everyone has access, you also said, everyone should have the same quality. And I think that's such a unique way. Sadly, I think it's a really unique way to think about healthcare, that everyone deserves the same ability to get care, and when they need it, the same quality of care. That's awesome. So, how can people reach you? How can people reach OneSight if they want to follow up, if they want to see what clinics are in their own countries, or maybe they just want to send you a note? Maybe they have questions for you. How can people reach you?
Uh, it's simple. To know more about OneSight, we have a website which is being filled with every information that you need. Impact we've created around the world is www.onesight.org. It's a very rich and informative website.
It's beautiful. It's a beautiful website. You guys have some of, and I guess it goes with the vision. You have some of the most beautiful photography and examples I've ever seen on a website.
Yes. Then our Twitter account is onesight.org. Feel free to contact through Twitter. Feel free to know about OneSight. And it's all responded to on 24-hour, I would say, timing. So from there, you can find us and talk to us. Yes.
Find you and talk to you. Excellent. Well, thank you for sitting down with me. I know you're so busy, you have patients to see, but I really appreciate your time having this conversation, and I appreciate you bringing us to Rwanda. And I do hope this model for vision care, but also the model of healing and hope and rebuilding is something that everyone in the world can look to.
Thank you so much.
Thank you. Have a great day.
Thank you.
All
Have a
right.
great day.
We'll talk soon.
Bye-bye.
Bye. And thank you, everyone, for joining us today. You know the drill. Be sure to subscribe. It will help make sure we can continue to bring you weekly adventures. And I know it's a pain, but please rate and review, especially on Apple. It really does make a difference and only takes a few minutes to do your part. Every 5-star rating or review has a really big impact. Last, send us a story at stories@theglobalgoodpodcast.com. Share remarkable work you or someone you know is doing to make the world better, or tell us about your special place. And be sure to send pictures, videos, and music. We want it all. This week's episode was researched and written by me, Nicole Roberts, with audio and production by WillPower Productions. Images and videos were provided by OneSight.